Surgeons have typically relied on their eyes during cancer surgery, but now a new technology has created a groundbreaking way to detect hidden cancer in real time. It's a second look that could save lives. To dive deeper into this, I'd like to welcome Dr. Fedra Fallahian and Lumicell's Chief Scientific Officer, Dr. Jorge Ferrer. Welcome. Nice to meet you. Pleasure. Pleasure. Have a seat. So this looks really interesting to me. I'm guessing that it's getting taken up pretty quickly. Tell us about it.
One of the great things about advances in surgery and medicine in general are that there are more avenues for people to get screened, so we're catching a lot of breast cancers earlier than we used to.
Is this a screening instrument or an intraoperative tool to detect margins, or both?
This is intraoperative,
okay.
But the reason it comes into play is because we're catching cancers earlier on in people.
I see, so they're smaller and they're more difficult to see.
Yeah, they're smaller, but that also is good because it means people have more options than they would if they were diagnosed later on. And one of those options is breast conservation. So the type of surgery we do involves just removing the tumor itself and some of the surrounding healthy tissue, but leaving the rest of the breast intact.
Is this just for breast cancer or any other cancers is it useful for?
It's only approved by FDA on breast cancers, although we're doing clinical investigations on other cancer types. So our technology consists of two components. There's an imaging agent called Lumicell, and there's a handheld imaging probe. We developed Lumicell to be what we call optically silent. It means that it does not produce a signal until it reaches the tumor. The drug is injected into the patient about 2 hours prior to the surgery by medical personnel, because they have to monitor the patient because there's a risk of allergic reactions. Once the drug gets into the tumor, the same molecules that the tumor produces to help it grow and expand recognize our molecule and literally break it apart. And once it's broken, it emits its fluorescent signal. We are allowing the surgeons now have a tool that they can actually look into the cavity where it matters most.
And you developed this, is that right, Jorge?
Yes.
And were you aware of this particular issue?
Yes. So the way we ended up developing the technology was by an all too common tragedy. Our founders of the technology, they lost loved ones to cancer, and they made a commitment to do something to help patients not go through what their loved ones did. And that's when a group of scientists, engineers, and doctors got together to develop the technology, which is the LumiSystem that we have today, fully approved by FDA.
All right, so we have a video that demonstrates exactly how this works, so let's take a look at that.
Lumicell is administered through the patient's IV via a 3-minute push, 2 to 6 hours prior to surgery. After removal of the main cancerous specimen, the surgeon will insert the probe into the breast cavity and, in combination with the cancer detection software, search for any residual cancer that may have been left near the margins or beyond. If the Lumicell DVS identifies areas that are suspicious for residual cancer, those areas will display on the screen in red.
So this is so interesting, and where it really hits home is with the patients, so I want to invite one in. This is one of Dr. Fallahian's own patients, Christy Cole. Christy, come on in. How are you? Nice to meet you. Have a seat over here. So tell us a little bit about your experience.
My overall experience was great. Dr. Fallahian done a great job. It was great to know that LumiSystem was available to detect any other cancerous tissue to prevent multiple surgeries.
I'm struggling with trying to figure out why a patient wouldn't want to do this other than allergic reactions. Did you have any resistance?
No.
How have you been since?
Doing great, cancer-free. I have my 6-month follow-up next month.
Congratulations. And when you were approaching Christy to do this procedure, what did you think? This ideal candidate?
Yeah. So someone who was undergoing segmental mastectomy or breast conservation, and just like you mentioned, it giving us that extra added accuracy and hopefully decreasing the risk of needing to do an additional surgery, putting you through the risks of surgery, but also the kind of emotional and psychological toll that takes on patients.
To me, it seems like a no-brainer. So congratulations. It seems like a really great procedure. And thank you, Dr. Ferrer, Dr. Fallahian, Christy. Thank you for sharing your story with us. If you want to know more, go to LumiSystem, LumiSystem, singular.com, LumiSystem.com, and then stick around. More Health Uncensored up next.